Hi class, this is Professor Instructor, and this is our instructor lecture that you need to view this week. So this week in our instructor lecture, we're going to be talking about our three joints. We have three different types of joints. We have fibrous joints, cartilaginous joints, and synovial joints. So if you pull up your PowerPoint, number 3, you'll be able to see that. My first slide that I'm going over is slide 3, fibrous joints, then cartilaginous joints, and synovial joints. Okay? Fibrous joints are the absence of a synovial cavity. So they don't have a synovial cavity. They're made up of collagenous tissue to reinforce bony junctions. And a good example of this is a suture joint. So a suture joint is found in the skull. These little small lines here have collagenous tissue. It's very tricky to say that, collagenous tissue that hold them together. So that's why they're called suture joints. They look like little suture marks. Another type of fibrous joint is a syndesmosis joint, and this type of joint is held together by ligaments. So it holds bones together by ligaments, and that would be an example of that would be your tibia and your fibula. Moving on, we have our cartilaginous joints. So our cartilaginous joints are made primarily of cartilage. A good example of this are our ribs. So our ribs, while they are bone, we have these portions of the ribs that are made up of cartilaginous joints, and they attach here to our sternum and our manubrium, which is right here. Another example of a cartilaginous joint is the pubic symphysis. And the pubic symphysis is this small little piece of cartilaginous tissue that's between your hips, and it allows your hips to move like this, all right? So this is especially important in women. It's typically immovable until women have high hormone changes during pregnancy and then birth. So when a woman is giving birth, their hips are able to open up a little bit more as their vaginal canal opens up, and their pubic symphysis allows for the movement of those hips to come slightly apart and for the baby to come down through the birth canal. So cartilaginous joints are really important. They allow for not just flexibility and movement, but a little bit more of, it's not bone, right? So it's a little bit more flexibility and movement here. Let's say for the ribs. Our ribs, if you were to push on your ribs, you can push them in and move them around a little bit. And a huge asset to that is when we're breathing. So when your lungs are filling with air and they're expanding, you're inhaling air, then your ribs are able to expand. And a part of that expansion is your cartilaginous joints. The third type of joint is a synovial joint. So this type of joint is inside of a synovial capsule. The synovial joint is inside of a synovial cavity, not a capsule, and it has synovial fluid in it created by the synovial membrane. So this allows for the joint to actively move in different directions depending upon what type of a joint is. And there are 6 different types of synovial joints: pivot joints, ball and socket joints, condyloid joints, plane joints, saddle joints, and hinge joints. So we'll start with our pivot joint. Pivot joints are uniaxial, so they have one point of axis, and a perfect example of a pivot joint is between C1 and 2, which is your axis and your atlas, and the C-spine, and it allows for rotation of the neck and the head. All right. Your second type of joint is a ball and socket joint, so it's exactly what it looks like. You have what looks like to be a socket, and then you have a ball in it. A good example of this would be your femur. So your femur head right here, and this allows for a good amount of internal and external rotation, and allows for different types of movement, different types of angular movement and rotation at the hip. Okay. Third type of joint is a condyloid joint, and this joint is an unstable joint formed by articulation of a shallow convex surface of the bone, and it's a concave surface of another, which is found in the radius and the carpal bone. So right here, between the radius and the carpal bones, is a condyloid joint. All right, and as you can see, it's not a ball and socket joint, but it is a little bit of a shallow convex of the bone. Third type of joint is a plane joint. So this joint can be found between the tarsal bones, and this joint is a joint that is opposing flat surfaces. So what I mean by that is opposing flat surfaces here in the tarsal bones. You have all of your tarsal bones sectioned off, and it allows for the movement. This plane surface allows for movement while we walk. Okay, so this surface permits limited sliding between bones so that we can move efficiently and walk on the ground. Our fourth type of joint is a saddle joint, and it's exactly what it sounds like as well. It's a bone that sits inside of another bone. So kind of like a saddle on a horse. The saddle fits over the horse's back, so does another bone fit on top of another bone. Okay, and a good example of this is between the trapezium, so right here in the hand, and the carpal bones. So the trapezium sits cradled with the carpal bones. Our fifth type of joint is a hinge joint. This joint is exactly what it sounds like in the fact that it is like a hinge on a door. So when you swing a door open, you can't push it open any further because there's a hinge that stops it. And a good example of this is the elbow. So let's say I was doing a dumbbell curl. I curl up and I flex, and as I extend, I come out. Well, my elbow can't go past this point of access. It's a uniaxial joint, all right? So it can't come back and twist and turn around the other way. I mean, it could if it broke. But right here, it's only on this hinge, so it's on a one-axis train, right? And those are all of our synovial joints. So there's 6 different types of synovial joints that are really important. A few other things that are important that occur with joints is gliding, angular, and rotational movements. So gliding movements, they can be classified in the intertarsals and the intercarpals. So that would be, if we go back to this picture of the skeleton, our feet and our hands. All right, slight gliding movements in our intertarsals and carpals, so that our bones and can move properly, so we can pick things up. An angular movement, an example of that would be at the elbow here. So an angular movement is in a point of access. So here's my axis, and I'm moving angularly. All right, I'm creating an angle. And then a rotational movement would be here at the femur. So we have our ball and socket joint, and our femur head is rotating in the ball and socket joint and allowing for rotational movement. So let's say this guy here, the skeleton, is walking towards me, and he wants to go over here to his left. His left, our right. He's going to turn here. He's going to rotate here at his ball and socket joint, and then his foot and the rest of his leg are going to fall, and they're going to go this way. Okay? So those are the 3 different types of joint movements, and then you have special movements like dorsiflexion. Dorsiflexion is you have your foot, your toes come down. Plantar flexion, foot comes up and toes come up towards you. Inversion, let's say that, this is my foot, my foot comes in towards the middle of my body, that's inversion. Eversion is out towards the back, towards the outside of my body. Okay? Pronation is up towards the ceiling, so my hands up towards the ceiling. Supination, down towards the ground. Radial ulnar deviation, that will be turning my wrists, right? Turning my arm. Radial ulnar deviation. You can look and find some more examples of that in your book. So, and the rest of these: opposition, elevation, depression, protraction, and retraction, and lateral flexion. So those are all examples of special joint movements. I just went over a few of them for you, but if you have any further questions, you can send me an email regarding those. Something really important to remember with these 3 joints is that they're all different. So they all have different functions and different movements. Fibrous joints, they have the job of protecting your skull, right? Or they, especially in babies, so they have fibrous joints right here in the top of their skull, okay? And a baby's head, when it comes out of its mother as it's being birthed, the skull comes in towards each other, so it allows the bones to overlap as the baby is born, so the head is not too big for the birth canal. Well, as the baby matures and the fibrous joints begin to really solidify, and then they begin to protect the skull. So the skull is actually fully formed, and then the fibrous joints take place. Cartilaginous joints, we need cartilaginous joints in order to breathe properly, in order for our ribs to expand, in order for our pubic symphysis to work so that a woman can give birth to a baby. Synovial joints, we need all 6 of these types of synovial joints for different types of axial movements. So whether that's rotational movements or gliding movements at the feet or angular movements at the elbow, all of them are important for everyday life. So that's just a little bit about the 3 different types of joints, and that is our instructor lecture for the week. So if you have any further questions, please feel free to send me an email, and I'm happy to answer those questions for you. I hope you all have a wonderful rest of your week, and I look forward to reading your work. Bye.